of Studio Homeopathy, and I am Dr. Ravi Doctor. We are here at this beautiful Juhu beach. कहते हैं that the ocean and the land is a collection of millions of elements and so much of life. But for we homeopathic physicians, so important are some very beautiful remedies which come from here. Whether it's silica or natramure or sepia or calcariaca, all of it comes from here. Now you all may wonder, what am I doing at the beach presenting materia medica? Yes, my dear friends, my friends. हमारे जो स्टॉलवर्ड्स है जिन्होंने ये पूरा मटीरिया मेडिका लिखा, उनका एक बहुत अलग नज़ारा था फॉर द नेचर, एंड दैट इज वेयर दिस बिकेम वेरी इंपॉर्टेंट. हाउ नेचर बिकम्स सो इम्पोर्टेंट व्हेन इट कम्स टू एप्लीकेशन ऑफ नेचर इन आवरसेल्व्स और इन सर्टेन डिजीजेस और इन ह्यूमन लाइव्स. तो चलते हैं टू अंडरस्टैंड द फर्स्ट रेमेडी ऑन विच आई एम स्टैंडिंग, सिलिका और सैंड. फ्रेंड्स, सिलिका or sand, it's very simple, very soft to touch, but on this stands one of the biggest architectures, or probably from this is made one of the biggest monuments in the world. Every architecture, building, everything which is created on land, it is because of the element silica. But if I make a small sand castle, जिसे हम कहते हैं, or a small mountain, or any kind of a structure with this, it is easily going to break because there is no support. Silicea requires support, whether it's from calcium, whether it's from granite, whether it's from graphites, all of it pulls together, combines it, and that's one of the elements which has also been used in modern architecture, is called cement or concrete. All of this makes silica a structure. Dear friends, हमारी लाइफ में भी काफ़ी ऐसे टाइम होता है where many of us may require support. हम बहुत चीज़ें नहीं कर सकते साथ में. And that is where when somebody comes across, when somebody helps us out, and that is where we can really shine up in life, and that is the element of Silicea. So let's understanding how Silicea becomes a drug picture and how important it is to use this natural principle in such a beautiful drug. So welcome to my formal presentation of Silicea.
Hello friends, so welcome to my formal presentation on Silicea, the homeopathic drug picture. As I told you, or as I showed you on the beautiful Juhu beach, where there's a fine collection of sand all over, and this is Silicea. So the chemical formula of silica or Silicea is SiO2, which is basically silicon dioxide. Now, silicon dioxide, if you study geographically, it is present in the Earth's crust as silica, which is combined with oxygen. Now, again here, if you can see the element of combination which comes. So sand is that silica sand, which contains 95% of the silicon dioxide, again combining with iron. So overall, silica is something which requires support. That fine little granules cannot stand by itself. So as a result of which, nature itself has provided its support, which includes number of elements. But for structures, what we talk about, for architectural buildings, what we talk about, where cement or concrete which is used, where the ore is silica, outside comes calcium, and then graphites, and then water. So all of it basically brings out a concrete or a definitive shape, and this can be used in principles in understanding Silicea, whether it's a psychological aspect or is a physical aspect of this personality. So moving on to the psychological understanding of Silicea through the same thoughts or the same perspectives. In psychological understandings, you see this beautiful photograph of this girl which is there on your screen. So this little one is sitting this side of the window. She's seeing all her friends play. सब उसके दोस्त सब खेल रहे हैं, but ये जा नहीं सकती है. On the other hand, when this personality again becomes big, again there is a lot of stress. And now this all what is seen as an anticipatory anxiety, which is usually performance related, which is very commonly seen nowadays, which is very commonly seen in children nowadays, where there is a certain inhibition because there is parental pressure, there is pressure from teachers, everything is about performance. And when the child cannot perform, or there is a certain amount of fear which this develops, and that is the fear of failure. Dear friends, ये बहुत खतरनाक बीमारी है where there is a fear of failure, even though you may know everything, but still you fail. And this becomes the core of this kind of a personality, which is Silicea. So as you can see, this little girl, वो डरती है कि मैं वहां जाके क्या खेलूं, अगर लोग मुझे पे हंसेंगे. Similarly with this man, he's so very well prepared. He's fantastic with his presentation, but when it comes to the presentation, everything collapses. Like many of us, आपने पूरी रात पढ़ी है और मे बी 6 महीने से आप इतनी अच्छी पढ़ाई कर रहे हो, but when it comes to actual performance, when it comes to performing in an exam, everything is blank. And what are you supposed to do at that time? You're not remembering anything. And that's the time, a simple thing, it requires a support. So if the child's mother or the father comes across and says, beta, don't worry, पापा या मम्मा यहाँ खड़े हैं, हम आपको देखते हैं, आप जाके खेलो. And suddenly the child gets up and says, okay, because the child sees support. Similarly with this man who's so stressed for his presentation or for his new assignment, where there is performance related issues, and that's where his colleague or his subordinate or his office staff comes across and says, sir, don't worry, hum hai yahan. And that is where they gain confidence. That is where they can go and they can perform. And this becomes the core of many personalities, dear friends. Even it is seen in Lycopodium, or even in Argentum nitricum, but with Silica, it's this very peculiar fear of failure. And that is where they start developing a fixed image about everything. So fixed image as well as fixed ideas. What if they say something? एक अपना एक इमेज बना लेते हैं कि अगर मैं फेल हो जाती हूँ, मैं रिजेक्ट हो जाऊंगी. अगर मैं फेल हो जाऊंगी, लोग मेरे पे हंसेंगे. अगर मैं नहीं कर पाऊंगी, तो so this is all which is there in these people's minds. So that is where a fixed image or a fixed idea which comes, and that is where they start withdrawing themselves. ये ज़्यादा सबके साथ mix नहीं होते. They don't like mixing around with people, and that is where the reserved nature of Silicea can be very well seen in these personalities. Many times, even in our classrooms or even in our certain friends, we've always seen that some group of friends are very, very reserved. वो जब किसी के साथ mix नहीं होते. They are either in their books, or they are by themselves in the canteen, or they are by themselves in the library. They're always by themselves. It is because of some kind of a psychological trait which these people are undergoing, some kind of an inferiority complex, some kind of a fear which is there and which requires to be tackled in today's world. And that is where fixed ideas, as I very well told you, and this is where they start developing obstinacy. So even if there are two people who come and say, even if the counterpart comes and says, चलिए ना हम जाते बाहर, चलिए ना ये करते, हम वो करते, but still वो एक obstinacy हो जाती है because of those kind of anxieties, those kind of fear, जो ये इंसान उसमें से बाहर नहीं आ सकता. And that is where it can play a very vital role in developing a personality. Now let me tell you, Silicea is one of the remedies which are high performers in the world, but इनको एक inert anxiety रहती है. If you remember, many of us come to belong to an era of Sachin Tendulkar and Lionel Messi and these big stars who've made immense fortune and immense name in the world of sporting. But these people were very nervous. If you read about Sachin or if you read about these people, you can see him biting nails. There is a nervousness which comes. So, but still, when the team players, when all of them comes across, or when the batsman goes across and says, "Don't worry, I am there." So if you remember the Sachin and Viru ka jo jodi hai, that was always there. Where he would always go and say, "Ki Paji, main khada hu, aap fikr nahi karna." That's where the whole passion comes. That's where he starts hitting the centuries. It's a simple support system which is required, and if you get that simple support system, I think you can conquer the whole world. I remember I used to be treating one IAS officer many years back. And for years together, he used to carry his photograph of his parents, and he would always tell me that, "Doctor Sahab, मैं कोई भी बड़े assignment में करने जाता हूँ. At times I have to report to the chief minister. At times I have to report to various bureaucrats, and there is always a nervousness." मैं जैसे ही वो photograph देख लेता था, I used to, even though they were not deceased, they were there, but still he would feel that नहीं, मैंने उनको देखा, they are there with me. This is Silica, dear friends. Lastly, they hate alcoholic drinks, dear friends. Alcohol today has become a social norm. It's pubs and restaurants where people like to go, people like to party. It's a socializing event where alcohol has become one of the medium. But Silica is a very reserved, very obstinate, and certain fixed ideas, and that is where one of the key rubrics also is hates people drinking alcohol and hates alcoholic drinks. So you can remember this personality with this kind of an outlook, and that will help you develop the drug picture of a psychological aspect of Silicea. Coming up to children, In pediatrics, Kent very beautifully writes, poor or difficult assimilation in these children. So support system ही नहीं है. The system is unable to take it. The bones are unable to take it. The bones are unable to develop. And that is where silica can come very beautifully for these children. Gets cold very easily. Weak, nervous children, especially students who are doing post-graduation in pediatrics, silica can one of the most leading remedies which can come in number of children who basically come out with poor assimilation, especially in coming out from lower socioeconomic strata. That is where silica can really come up very well. So irritability and timidity, again, seen on a psychological sphere in these children. Coming up to physical particulars, moving on is to the head symptoms. Very classical. Now in homeopathy, please remember the uniqueness of symptom is very important. It is on which basis you can prescribe. Headache, as if the pain travels from the cervical region and it comes and it settles on the forehead. Again, in Kent's Materia Medica, Kent very beautifully writes, the pain is in towards the early part of the morning, it is there on the cervical region, but as the day starts beginning, it comes and it settles over the eyes. And that is a very classical symptom of Silicea. Another very beautiful remedy, Sanguinaria canadensis. Again, Sanguinaria is a right-sided, so if the pain has come and settled on the right side, then please remember Sanguinaria can be one of the remedies. Now, again, in this photograph, which you can see that the person is wearing a cap, so please remember that yes, these people are always better with wrapping up with a warm cloth altogether. Lastly, clinically, अगर आपको ये दवाई देनी है, then ophthalmic headaches or supraorbital neuralgia, lacrimal duct infections, but iritis, cataracts, so anything which relates with the eyes, and there is pain, there is neuralgic pains, please think about silica as one of the remedies which can really become of great benefit to these patients. Moving on to the leading remedies in upper respiratory tract infections, I would rather, these are the frontline remedies, so especially in recurrent tonsillitis, or what we say as squinsy. Dear friends, silica में एक अजीब सा ये tonsillitis होता है, that every 2 months or every 3 months tonsillitis तो होता है, but in these tonsillitis, whenever there is suppurative, मतलब उनमें पस हो जाता है, तो patients antibiotic वगैरह लेते हैं, but then in the end they get so tired, कितनी बार मैं antibiotic लूँ? Silicea can be one of the leading remedies which it can help to these patients. The other word what we use even for suppurative tonsillitis is quinsy. Good remedy for parotitis. Another good remedy also for parotitis is, or with mums, please think about pulsatilla. But please examine the patient, examine for cervical glands, examine for supraclavicular glands, because these are repeated throat infections. You require to be clear in what you're treating. But again, a word of caution, dear doctors, with the current pandemic, please remember, have a protective gear. Ab jab bhi throat examinations karo, please rule out everything which is possible so that you are clear when you're treating. Dear friends, of late, I've also been seeing post-COVID patients coming out to me with the throat infection hua tha. Now I'm out of it, but again, Dr. Saab, ye mere ko baar ye throat mein infection hote reh raha hai, and the pus keeps coming up. Please think about Silicea as one of the remedies, but please remember modalities have to go hand in hand. So better with warmth, which is external warmth. As you can see, this lady, she's tied a beautiful muffler all around her, and internal. Of course, with today's current pandemic, also we have been also seeing people using a lot of inhalers, steam inhalers. We are doing a lot of gargling, drinking a lot of water. Please, that is again something like an auxiliary treatment which has to be continued. But yes, with silica, it is a very classical feature that even if it is 40 degrees outside, even if it is fuckingly hot outside, still the patient is better with warm application and warm drinks. Moving on to lower respiratory tract infection. Again, there is cough, so there is infection from the throat which has traveled down to the chest. So helps post pneumonia. Very important symptom. Pneumonia the patient was affected with pneumonitis. Now the patient has come out of pneumonitis, but still the nagging cough is not yet gone. And especially when the suppurative stage has set in, where still the patient is bringing out yellowish expectoration, please, Silicea should be thought of. But another very beautiful remedy which comes again with this kind of a symptom, with expectoration of yellowish small lumps. Again, Kalibai is one of the leading remedies which can be thought of. But in Silicea, Cough is more when lying down, but cough is better and better warmth. Moving on to the gastrointestinal symptoms. In my in clinical practice, this is something which is very helpful, and that comes very helpful in a surgical condition, which is fistula in ano, very troublesome for the patient. It's a small fistula which is developed in the anal region and which can be very troublesome. Every 15 days or every month, the patient starts developing a pustular discharge there because of repeated infections. Silicea can be very handy in such cases. Lastly, again, becoming specific to the stool symptoms, the stools are very hard. It recedes back. So the patient is sitting on the pot and the stool comes out and the stool again recedes back, especially again seen in small children. So the stool comes out and the stool returns back. So please think about Silicea. But another two very beautiful remedies is Sanicula and Thuja. Coming up to skin conditions or dermatological affections, this beautiful photograph is of foot sweats, and then the second one is of an abscess. Now, talking about foot sweats, offensive foot sweats. So, aapke ghar pe you've called a guest, and unfortunately, his shoes and his feet are very smelly. So, even after the party is over, or even after the meeting is over, the person has left. Still, the stench is left at home, and it can be very psychologically deteriorating for the patient because he is very ashamed of himself because of that particular complaint. Now that is called bromodosis, means offensive foot sweats. Now this is commonly seen due to bacterial and fungal infections which are commonly seen in foot. Now Kent writes so beautifully, especially suppressed discharges leading to foot sweats. So just imagine you are in a humid climate where there is a lot of sweat which is happening in the feet, but you don't change the socks properly or you don't change the shoes well, and that is where these bacterial and fungal infection, especially for athletes, foot is one of the most important conditions. That is where the infection starts to develop, and that can be very nagging. But along with Silicea, personal hygiene, cleaning of the feet well, changing of the shoes, changing of the socks very regularly, cleaning of the foot, again, dipping your feet in potassium permanganate water, something like seeds bath, again, very useful in fistula and ano, can also be used there. So using seeds bath, again, for feet, dipping it in such water, and these hygienic conditions, along with Silicea, can really benefit the patient. Now, coming up to abscess, dear friends, three remedies which are always seen in Materia Medica: Heparsulf, Calcirasulf, and Silicea. They are a trio. So Silicea ripens the abscess and promotes suppuration. And that is where it is very helpful in skin condition, especially when it comes to abscess. So abscess को ये basically ये suppuration को promote करता है. So first cyclical remedy is starting with Heparsulf, then moving on to Silicea, and then Calcirasulf. Again, warmth application आप जैसे देते हैं, जो abscess का मुंह होता है, और the opening of the abscess actually opens up, it dilates, and the infection can come out, and that is where Calcirasulf can be thought of. So Heparsulf starts it, Silica basically ripens and promotes the suppuration, and Calcirasulf helps drain the abscess. And later on, Silica again can be followed later on to prevent certain abscess formations. Lastly, helps absorb scar tissue, especially keloids. Dear friends, post-surgical scars can be very nasty. They can be very traumatic because it continuously reminds patients, and keloids can grow, especially with post-cardiac surgery when there is a big scar which is there on the sternal, and that is where it can be reminding the patient of the bad event which the patient has undergone. But still, when it starts hurting, keloid starts developing, Silica can be thought of. Another very beautiful remedy is Thiocinamium. So you can use these remedies, become very handy, and in these kind of chronic cases where there is nothing which helps. So instead of plastic surgery or repeated surgeries, why not use Silica? Moving on. So in general now, so this photograph talks about Silica, that the very chilly patient, even if it's 40 degrees outside or 45 degrees outside, very hot outside, like many parts in India, but still the patient, when comes home, the patient wants a fan to be switched off, air condition to be switched off, and always better with warm coverings, always sweater जैसे कपड़े पहने हैं और thick long sleeves पहने हैं, and that is what is a very typical observation which you can do of Silica. Better in summer, worse new moon. Here is again cyclical moon phases. So Silica is one of the remedy. Another very beautiful remedy is Datamure, especially in cases of asthma. Please, this is one of the remedies you can think of whenever the patient has worse new moon aggravations. Cyclical, again, this is what I talked about, hepatic sulfur and calcareous sulfur in conditions like abscess formations. Lastly, it is complementary to calcarea and thuja and sulfur, of course, because it is again multi-miasmatic, but it does not follow mercury. Please remember, it does not follow any kind of a mercurial application, where if you have given merc sol, and please do not follow it with silica, there can be a time where the patient can throw out a particular aggravation. So there is a syphilitic remedy which you have given and then you followed up with Silicea. So please be careful. Materia medica में जो ये remedy relations दिए गए हैं विलियम बोरिक ने पीछे, please try following it, because they really form the basis of cyclical remedies or remedies which can follow one each other. Moving on to summarize completely, the child photograph which I showed you, which is behind. Now this child requires nothing, but this child requires the father or the mother coming and say, Beta, I am there. We are there with you. We stand by you. And that's what is required for this child. So again, obstinacy, anticipatory anxiety, fixed ideas, reserved. With this gentleman also the same, where there is requires support. Lastly, then comes the headaches which are there for silica patients. So headache is usually better with warm applications. Cervical headaches coming and settling over the eyes. Ophthalmic headaches very beautifully acts. Coming up to respiratory, quinsy in the throat, sore throats, again suppurative tonsillitis, parotitis, very beautiful remedy. In cough, post pneumonia, please think about silica. Lastly, in dermatological conditions, when it comes to offensive foot sweats, please again here hygiene is very, very important. Lastly, beautiful remedy for abscess, but yes, the most important is application of external heat and ameliorated by warm drinks is very, very important, which completes a complete totality of silica. Lastly, please remember, these are few symptoms which I have given, but again, forming a totality, forming a repertorial materia medica totality is very, very important, and individualistic is very, very important. And now let's get back to the beautiful Juhu Beach, and let's not miss the beautiful waves. So continue watching. Live, learn, love homeopathy.
So friends, I hope you enjoyed our presentation on Silicea the Homeopathic drug picture. A small little grain of sand can become such a big structure in life. We all have Silicea and we all may require support somewhere in life. So that's why let's keep supporting each other. Let's be the calcium or the carbonate or whatever in our lives so that we can become those enormous structures in our life. Lastly, हमारी channel पे आप सब्सक्राइब करिए, देखिए. There are a lot of beautiful videos are also going to be coming. Studio Homeopathy really brings out the flavor of homeopathy, and that's where we can really combine clinical knowledge, materia medica knowledge, and all of it together. So in the end, be safe. Please social norms follow करिए and live, learn, love, and come. Thank you.